Hi, I'm Dr. Tarone Lodog. I'm with the Pharmaca Health Advisory Board, and today I really wanted to talk about some of the nutrients that may be very important for you during your pregnancy. If you are pregnant, congratulations. I hope every one of you is out there taking your prenatal vitamins. Prenatal vitamins are critically important. They're actually important, the folic acid, even before you become pregnant, but you want to make sure you're getting all of those nutrients throughout your pregnancy. When you're looking for your prenatal vitamin, there's a couple of things that are important. One is the folic acid, as I mentioned, but two is something called iodine. Most people are aware of this because we iodize our salt, but you may not know how important that is for you during your pregnancy. Iodine is critically important for the mental development of your baby, and it's one of the leading preventable causes of mental retardation in the world, just making sure women get enough iodine. Now you may be thinking, gosh, how could iodine deficiency be a problem in the United States? Well, it's because of a couple things. Many of us have cut back our intake of salt. Some women use sea salt, which doesn't guarantee you the right amount of iodine. And third, there's a chemical in the environment that's both naturally occurring and also a byproduct of rocket fuel that gets into the earth, comes back into the earth, gets into the water, and then gets into the food supply. The American Thyroid Association has actually been concerned enough about this that they recommend all women look for prenatal vitamins that provide 150 micrograms of iodine. If you take that, then you can help prevent any kind of deficiency that may occur. Perchlorate has a unique effect on the thyroid. What it does is there's a little pump inside the thyroid that allows your body to take up iodine from the diet. If you have perchlorate, it binds that pump and prevents you from being able to take up as much iodine. If you make sure your prenatal vitamin has iodine in it, you should be getting enough not to make this a problem. Now, as you move through pregnancy, there's a couple of other things that you want to think about in that last trimester. Omega-3 fatty acids, vitamin D, and possibly probiotics. Now, vitamin D is really important. There was a study that was done at Johns Hopkins where they took girls under the age of 18 who were African American in Baltimore, Maryland, and they checked their vitamin D levels. 46%, almost half of them, had insufficient vitamin D. Almost 1 in 5 had frankly deficient levels of vitamin D. If you don't get enough vitamin D in pregnancy, it can affect not only your baby's bones, but it may increase your risk of things like preeclampsia. So it's very important that you talk to your midwife or your healthcare provider about, has your vitamin D level been checked, and do you need extra? I tell pregnant women 1,000 IUs per day is a pretty good amount for anybody. But if you're dark-skinned, you live up in northern latitudes, you really want to talk to your provider. You may need 2,000, 3,000, 4,000. Up to 4,000 is considered safe from the Institute of Medicine. But when you get up to the higher levels, I really like you to work with somebody before you just start taking it on your own. Omega-3 fatty acids are something else that's really important. We get these in our diet, but one of the best sources is from fish. So taking a good quality fish oil starting from the 25th week of pregnancy on after birth, especially if you're breastfeeding. If you're a vegetarian and you don't want to take fish oil, we do have vegetarian products that are available in the form of DHA. That's the part of the fish oil that's critically important for you and for your baby. So if you're a vegetarian or vegan, make sure that you're looking for a vegetarian supplement that's providing 200 to 300 milligrams of DHA. If you're not a vegetarian, just look for a high quality fish oil product and make sure, again, you're getting somewhere around 300 milligrams of DHA, and the EPA 600-700 milligrams is fine. Last but not least are probiotics. Probiotics may play a role in helping your baby reduce the risk of your baby having asthma, allergies, or eczema. If you take this in the last month of your pregnancy, a blend that has lactobacillus and bifidobacterium, sort of a combination multi-strain product, and your baby is born vaginally, you may actually give your baby some added protection. If you end up having a cesarean section, for your health or for the baby's health, you want to talk to your pediatrician or your doctor or your naturopath about, should you be giving your baby probiotics for the first 6 months. There is evidence that babies that are born by cesarean section have increased risk of cow's milk allergy, IgE-mediated allergies, so these are the kinds of food allergies and hay fever allergies that you can get. And by taking probiotics, giving the baby probiotics for the first 6 months, you may actually really be able to give them some protection. So in pregnancy, prenatal vitamin, Iodine, 150 micrograms. Ask your midwife or provider about vitamin D levels. Get 1,000 a day. If you need more, do so under their direction. Omega-3 fatty acids starting at the 25th week through pregnancy, and then afterwards if you're breastfeeding. You need that 200 to 300 milligrams of DHA every day, so get it from a vegetarian source or fish oil. And consider probiotics, either a multi-strain supplement or a great yogurt that has those live active cultures in it throughout the last month of pregnancy. If your baby's born by C-section, think about using a multi-strain for the baby for the first 6 months to give them some added protection.